Welcome to Valley View University's webinar. My name is Julia Koch, and I'm a physical therapist.
How's it going? I'm Dan O'Connor. I'm an orthopedic surgeon. Been at Valley View a couple of years now. I do general orthopedics, but my subspecialty is in hip and knee replacements for arthritis typically.
Hi, I'm Shelby Hickle, and I'm one of the athletic trainers here at ValleyOrtho. A few housekeeping items to address before we get started. You can submit questions through the Q&A chat on the bottom of your screen. Your question could be answered live at the end of the presentation. We will try our best to answer your questions. We are unable to answer questions regarding personal health information.
All right, we're gonna get started. Thanks, everybody.
So thank you for joining us for tonight's presentation on strength training for healthy knees. So a quick disclaimer, this content is only for informational purposes and should not be used in place of an actual doctor's visit. So objectives of tonight's presentation are to understand why strength training, what strength training is and how it benefits your knees and overall well-being, basic understanding of strength training, and when to seek a healthcare professional or an exercise professional for medical clearance or additional guidance. Here is a quick overview of the topics of the presentation. So strength training is a type of exercise when your muscles work against some sort of force or resistance. There's different ways to strengthen your muscles, but during this demonstration, we're going to review dynamic movement that will strengthen your muscle for different activities that you enjoy doing. All right, so to start off, I want to discuss some benefits of strength training beyond your knees. Strength training protects your body from injury. Your muscles have a higher metabolic rate, so you burn more calories at rest, and you retain the ability to perform everyday activities as you age, such as getting up and on and off the floor and balance. It can also improve your quality of life by increasing your quality of sleep and decreasing depression and anxiety. Strength training also can strengthen or maintain your bone health. In addition, American Heart Association has shown that 30 to 60 minutes of strength training a week decreases your risk of diabetes, high blood pressure, and cholesterol. There's also a 14% decrease in your overall all-risk mortality. If you couple that with the recommended aerobic exercise and strength training, you can decrease your overall risk of mortality by 40% when compared to on-active adults. So this slide chart shows a rough estimate of the force that goes through your knees with different activities. For instance, walking can be anywhere between 1/2 of your body weight to 3 times your body weight. Jogging or running can be anywhere between 3 and 8 times your body weight. If you think about skiing, it's a similar motion to squatting, so you can think about 7 times your body weight going through your knees. This is why it's important to strengthen the muscles around your knees to decrease the impact on the joint. So a quick overview of the knee joint. The picture there is the front of the knee, and you can see the top bone, your thigh bone, and your shin bone, and that's where your knee bends and straightens. Then you also have your kneecap, which is your patellofemoral joint. The kneecap is embedded in your quad tendon, and it increases the strength of your quadricep muscles, in addition to protecting the front of your knee. So here's a quick overview of the muscles around your knee. On the left is the front of the knee, and you can see you have 4 quadriceps tendons that are muscles that form one tendon that goes over the kneecap and attaches to the shin. These muscles work to straighten your leg. And then on the right, the back of the knee, you can see there are 4 hamstring muscles, of which 3 attach at the hip, and then they cross over the knee, attaching on the shin bone. You also have the calf muscle that attaches above the knee, and then attaches also at the ankle, and these work to bend the knee. So according to the American Heart Association and the American College of Sports Medicine, these are the recommendations for healthy adult strength training. Exercising each muscle group at least 2 times per week. Target moderate intensity by reaching fatigue at the end of 8 to 12 reps for 1 to 3 sets. So at the end of 8 reps, you should be fatigued, but not exhausted. And you should feel like you could do 1 or 2 more repetitions with good form. Strength training can include free weights, body weight, resistance bands, and machines. You should rest 2 to 3 minutes between sets and allow for 2 to 3 days rest. And when I say rest, I mean before strengthening again, the same muscles again, but you should carry on with your aerobic and maybe other muscle strengthening. So where to start? Have you lifted weights before? Just to gauge how comfortable you are. What activities do you enjoy? And how can strength training help that? What equipment do you have access to? The exercises that we're going to demonstrate tonight should be easy to replicate in your home, as long as you can get creative about a weight and you have a sturdy stair or a sturdy step. So do you have any pain? At the end of the presentation, we're going to go over some modifications that you might be able to work through to safely work through pain. But if you're not comfortable with that, you can always, if you're not comfortable or the pain persists, you may need to schedule a visit with an orthopedic doctor for further evaluation and a possible physical therapy referral. And then, do you have any health conditions or take medication that require medical clearance? You should schedule a visit with your primary care provider for medical clearance before starting a new exercise program. And then lastly, it's important to warm up. You should warm up for at least 5 to 10 minutes of moderate walking or biking to prepare your muscles for strength training. So once again, strength training is a great tool with lots of benefits, but it's important that you have good form to keep yourself safe. So strength training should be specific to your fitness, health, and goals. Everybody's strength training program is going to look a little bit different. You should always prioritize form with body weight before adding any weights. Increase your weight slowly and only with good form. And then once again, you should seek medical clearance if you have a chronic disease or an older adult. There will be some modifications if you are an older adult or if you are a person with a chronic disease, which include higher reps with lower weights. So you may be targeting sets of 10 to 20 repetitions until you reach fatigue. So we are going to demonstrate multi-joint exercises. This means that they activate several muscles across multiple joints, including your upper body, your hips, your knees, and your ankles. Muscles that will be strengthened include your quads, hamstrings, glutes, calves, and core. We'll also show a few progressions of these exercises. Okay, so I do want to spend a minute to go over body mechanics. Since these exercises are strengthening several joints. So in the illustration, the green check mark, you can see that the ears, shoulders, and hips are in a straight line. This is, he is maintaining a neutral spine, which means that he is keeping the natural curvature in his spine, which is a safe way to perform the exercises. The illustration with the X, you can see that his low back and neck are both curved, predisposing him to injury. Then the pictures of the woman on the right, you can see the check mark, and her ears, shoulders, and hip are in a relatively straight line. So once again, she has that neutral spine, maintaining the natural curve in her back. Then the middle picture, you can see how she's folding forwards in her back and her head, which would predispose her to injury. And in the last picture, she is excessively arching her low back, which would also be bad form. Okay, so the hip hinge is a way to fold from your hips while maintaining a neutral spine. So Shelby and I are going to quickly demonstrate that. Okay. So in order to practice this motion at home, you can use some sort of a stick. People, you might not have a towel. So you want to make sure you have 3 points of contact. Let me face this way a little bit. So it should be touching the back of your head, in between your shoulder blades, and at your tailbone. And then why don't you face me? So separate your feet a little bit and bend your knees a little bit. So starting from standing, Shelby's going to bring her butt back and her chest forward, maintaining contact with those 3 points as she goes down and up. So why don't you do that a few times? So the hip hinge is important for all the exercises, but it's especially important for the squats and the deadlifts. So just so you can picture how the hip hinge is incorporated into those exercises, why don't you perform a squat with the dowel on your back? We'll go over these exercises more in depth in a few slides. So she is maintaining those 3 points of contact through the whole entire motion. And then, yeah, so then the Romanian deadlift would be the same as the hip hinge, but you'll add weight. Okay, back to the presentation. Okay, so another thing that we want to pay attention to is what our knees are doing. We want to avoid you want to avoid your knees from going inwards. So you may be your knees can go inwards because of maybe the arch in your foot or weak hip strength. So you may be familiar with certain exercises that target muscles on the side of the hip, such as side steps, monster walks, and clamshells. We're not going to review those today, but we will review some single leg exercises that target the muscles on the side of your hips to give you that control and strength to prevent the knees from going inwards. If you're not able to make this correction, you should seek expert advice in order to strengthen your muscles safely. Okay, so the first exercise we're going to review is a squat. The squat's going to strengthen all of the muscles in your lower body. So the easiest way to perform a squat would be sitting and standing from a chair. Then a progression would be to increase a body weight squat. So a progression would just be a body weight squat as shown here. And then you can make that harder by adding weight or increasing the depth. I would not expect your squat to look like that illustration. You need to stay in a range that's comfortable for your body. And then the picture all the way on the right, she's performing a staggered stance squat, which is starting to transition to a single leg squat. All of the weight is in that back leg. Go to the next slide and then we'll demonstrate. Okay, so step ups and step downs are single leg exercises. Single leg exercises are great because they target single leg strength in addition to balance, which is going to be important when you are stepping over rocks and when you're fishing or stepping off of a log when you're hiking. Step ups are normally easier to perform. She has a higher step in this photo. And then step downs are normally a little bit more challenging. You can see how there is a yellow line across the picture's waistband. So by being able to keep your waistband parallel to the floor, as you drop that heel to the floor, you're going to target the muscles on the side of the hip that can help you to control that knee from caving in. All right, so let's demonstrate those exercises. So we'll start with the squat. Okay. Let's do a body weight squat. Okay. Okay, so yeah, we'll do one facing forwards and then one to the side. So yeah, your feet are going to be about shoulder width apart. Your toes can be pointing forwards or out to the side. And then, like we discussed, you're going to maintain that neutral spine. You can initiate the movement by thinking about bringing your butt back to help get equal bend through your hips and knees. Great. And then you're also making sure, why don't you do one more, that the center of your knee is going over kind of in line with the tip of your shoes. And that way you know that your knees are not going in. Okay, and then one from the side. So next, we'll perform the step up. Make sure that the step that you're using at home is sturdy. So you're going to put your working leg, your entire working leg on the step, and then lean forwards, putting your weight on that foot, and then stand on up. And then nice flow and controls. You're going to keep the working leg on the step and lower yourself back to the floor. Good. And then you're going to keep that working leg on the step until you're done with the set. So why don't you do about 5? You don't need to tap your foot on the step each time. One thing I did not mention is with single leg exercises, it does require a significant amount of balance. So when you are starting this exercise, make sure you're near a counter and you have something to hold onto with your arm. As you get better, your balance should improve and your comfort might increase, and then you can move away from the counter. Okay, so let's review the step up, and I will have you face the camera for this. Okay, so you're gonna start on the step. Yeah, your foot right on the edge. Perfect. And then why don't you put your hands on your hips? Good. So as you lower, you're gonna keep your kind of heel in line with the arch of the standing leg and bring your toes up. And then as you lower that heel to the floor, you're going to make sure that your hips stay level. Good job. Okay, why don't you try one more? What we don't want to see is your hip dropping as that heel is lowering, as that foot is lowering towards the floor. Do you want to demonstrate floor form? Yeah. So you can see how her waistband now is on an angle. So once again, by keeping your hips parallel to the floor, you're targeting muscles on the side of your hip, which is going to help you to control your knee from going inward, both in strength training and also hopefully when you're out doing the recreational things that you enjoy. All right, back to the presentation. Okay, so the next exercise we're going to review is the lunge. A lunge is a great way to strengthen. We'll do the next two together. The lunge is a great way to strengthen all the muscles in your lower body. The first picture of the illustration, you can see, since this also requires balance, she's using a chair for some assistance. And then the other picture is a progression of both balance and with weights. Okay, and then the last exercise we're going to review is the double leg Romanian deadlift, which is a muscle that's going to target the muscles in the back of your legs, which is important to have strong hips to take some pressure off of your knees. The picture to the right is the single leg. We're not going to review that tonight, but once again, that is a balance exercise. So you should start with support from your arm. And then the same thing, you need to keep your hips level with the floor in order to target the muscles on the side of the hip and prevent that, help to control that knee from going inwards. Okay, so let's demonstrate those last two exercises. Okay, so why don't you use this table just to help yourself with balance. And then starting with your feet about shoulder width apart, you're going to take a step forwards, a big step forwards. Great, and yes, you should be on the toe of the back leg. So then why don't you start by keeping your spine straight and dropping your back knee about a quarter of the way to the floor. Great, and then come on up. How did that feel? That was good. Good. So if it's comfortable for you, then you can go a little bit deeper down. So why don't you go halfway? How did that feel? That was fine. Okay. So then the last progression was to bring that knee to just above the floor, just hovering the floor. Great. And then you're aiming for about 90 degrees in the front and the back knee. Why don't we just show that one more time? Yeah. Good, and straight down, and then kind of a nice right angle here and a right angle on that back leg, and a nice upright spine. Great. And then, so as we mentioned before, the hip hinge is similar to the Romanian deadlift. And it's going to be crucial that you keep that neutral spine and can perform a pain-free hip hinge prior to doing this, because it has the potential to irritate your low back. So why don't you grab that 15-pound weight? Good. So once again, feet about shoulder width apart. Good. A little bend in your knee. And then keeping the weight close to you, you're going to bring your butt back and your chest forwards. Great. And then I would just go to your knee. I wouldn't go past your knee. One more time. And then on the way up, think about driving through your heels to engage your glutes more. All right. Thank you, Shelby. All right. So rest and recovery. So strength training and lifting weights, it breaks down muscles and then the muscles rebuild stronger. So it's essential to eat protein throughout the day and possibly after you work out to help with the recovery. A good night's sleep is also important to help with the recovery. And then once again, we said resting 2 to 3 days between strength training of the same muscles to allow those muscles to rebuild without overuse. Okay, the most important, how do you progress? You can add additional sets. You can increase the depth of the exercise like we showed with the lunge. You can add single leg exercises in. And I do think it's important that single leg exercises should not replace double leg exercises because they're both important. And then add weight. Once you're able to perform 3 sets of 12 repetitions and feel as if you can do 2 more repetitions for 2 sessions, then it's time to add weight. This is a concept of progressive overload, in which we want to gradually stimulate the muscles in order to continue to build strength. When you do add weight, about 5 pounds should be safe, and you should expect to be doing closer to 8 repetitions per set. When you do add weight, it is normal to experience some muscle soreness. Okay, so as I touched on before, managing pain and strength training. Some of you might have knee pain, and I'm going to discuss some ways that you might be able to work through it. So if you are experiencing pain, you should start in a smaller range of motion and use body weight or reduced weights. Hopefully you can find a zone that you're able to strengthen with minimal to no discomfort. We want you to strengthen without increasing your irritability. So you shouldn't be limping the rest of the day. You should hopefully maybe even feel less pain. You definitely shouldn't wake up the next day with more pain. We want you to find that safe zone. So as your muscles strengthen, you may be able to increase the range of motion and add the weight back in without that discomfort. If you do continue to experience pain, you should schedule an appointment with the doctor, and they can prescribe physical therapy to have an exercise professional safely help you with strengthening. I think if you are, sometimes maybe you're not comfortable going through the modifications, and then you can reach out to your doctor sooner. If you are comfortable trying to find this pain-free zone, then maybe you can troubleshoot it for 2 to 4 sessions or 1 to 2 weeks. And then, of course, strength training is challenging, and a mild burn is to be expected as your muscles fatigue with your exercises. Okay, questions?
Thanks, Julia and Shelby, for doing that. And just to reiterate, I agree, strength training is super important. For all the reasons she mentioned, we also know that your muscles themselves are really important biologically for your body healing. And that's not just healing like a muscle injury, but also fractures, tearing ligaments, things like that. The muscles themselves actually secrete different chemicals that actually help your body to heal and recover. And so maintaining your lean muscle mass is actually really important for a whole host of reasons. One, for healing when you do have an injury, but also to try and keep you doing what you like to do safely without injury. And so we're going to go to a couple of questions here.
So if an individual has a knee locking up more frequently, should she see a provider or should she go to physical therapy?
That's a great question. I would say this. We talked about muscles a lot today. Your body is made up of a lot of things: bones, cartilage, meniscus, ligaments, tendons, muscles, and nerves, they all work together. And so sometimes something that might be good for your muscle may be irritating something else. It might be irritating your cartilage or your meniscus. And so when a patient gets a locking or catching in a knee, that often indicates a rough surface or an irregularity within the knee joint. Sometimes that's something that will settle down, sometimes it's not. And so I would generally say if there's a little noise in your knee and it doesn't hurt, you're fine. But if you're getting locking to the point where the knee won't bend, or when that occurs, there's lots of pain associated with that, that's a sign that you probably should be evaluated by an orthopedic surgeon.
What should I do if I'm having pain during squats?
Okay, so what should you do if you're having pain during squats? So we discussed decreasing the depth of your squat in addition to using only body weight. and trying to find maybe a range that you can perform with mild discomfort to no pain. So maybe that's only about 30 degrees, but that would be your starting point. You can also perform maybe some isometrics at the end of that pain-free range in order to challenge the muscles. And then we would hope that the muscles can strengthen to support that joint. And then you might be able to progress from there.
There's lots of reasons to have pain, right? And sometimes it's your technique. You've got bad technique, and your posture's bad, and you're not keeping a neutral spine. And it always depends on where is your pain. Is it in your knee? Is it in your hip? Is it in your back? And so it's important to think about, not just it hurts, but what's hurting. Is it actually it's my ankle that hurts or something, like figure out what it is. And then like Julia mentioned, try and see if you can find that comfortable zone, a zone where you can get some exercise, you can feel the burn without putting yourself through significant discomfort. A lot of times, depth of squat has a big factor there. When our knees bend, the further we bend, the knee actually slides back a little bit, and it can load the meniscus in the back of the knee. And so sometimes if you have a little bit of arthritis in your knee, or you have a small meniscus tear, not going so deep into that squat can allow you to get a good exercise without overloading that injured area.
And one good way to also see if you're having good mechanics, like Julia and I had demonstrated, that knee caving in, doing those squats in front of a mirror, that way you can see yourself and make sure that those knees aren't caving in. That could also cause the pain. When I'm doing a lunge, should my knee go beyond my foot?
So if I'm understanding this question correctly, you're wondering if that knee should go over your toes. So I do think that is going to stress your knee more. So that's why if you're starting out, I think I would recommend keeping your knee kind of above your ankle in that 90-90 position.
Yeah, absolutely. As that knee flexes, you're going to increase the load on the patella. You're going to increase the load of that patellofemoral joint as well as on that quadriceps. And so that actually can be a good progression. As you have strengthened, you've started with lunges that aren't so deep, and you're progressing well, you're not having pain, and you get to that point where you're like wanting to push to the next level, you can add weight, but also going into that deeper position, letting the knee roll forward. People will talk about knees over toes. It does increase the load in that knee quite a bit. And so I always say do that with a little bit of caution. But if you're able to progress into it and build into it without pain, it can get you a little bit more force through that muscle, which is one of the things we're looking for. But in patients who maybe have a little bit of arthritis or meniscus injury or a little tendonitis, sometimes that might overload it a little bit. And so I would just do that carefully after a nice progression towards it.
So kind of two questions in one. We have two participants. They both have artificial knees or hardware in their knees. Can they be doing these exercises, or are they good for them?
Yes, I'll take that one. Knee replacement and hip replacement, that's what I do. That's what I love to do. I also fix things that are broken, any sort of broken bones. But I would say, yes, you can do them. And they are good for you to do. When someone has a replacement, they're replacing the cartilage in their knee, essentially for metal and plastic. But when a knee replacement happens, we don't replace all the tendons and muscles and things like that. You still keep all those. And it's really important that the stronger you are, generally speaking, the better that knee replacement is going to function. So exercise is super important, maintaining that muscle mass. And it is okay to do squats. It is okay to do lunges, especially if you're able to do them without significant discomfort. That's the goal. I would say that things that you might want to avoid with an artificial joint are things that have more impact. So some people will do things like squat jumps as sort of a next progression of more dynamic explosion type activities. And those are activities that I wouldn't necessarily recommend with a replaced joint. I recommend more of the traditional eccentrics, concentrics, and isometrics. And what that means is going through those exercises slowly and deliberately in a controlled fashion. And then the isometric is where you're holding a position against a force, but you're not moving. That's actually really important for tendon health and tendon healing. What we've sort of talked about today is a lot about muscle, but it is important that the muscles pull on a tendon and that pulls on a bone, and that's what makes you move. And those are all connected. And so sometimes doing the strength training where you're doing a dynamic exercise, that's really good for the muscle. But tendons actually repair themselves better with essentially being held against a constant force of doing an isometric. And so it's important to build in some tendon strengthening and tendon rehab in addition to those muscular things. And that's very important in someone who's had a knee replacement. So not so much focused on dynamic, explosive activities, more on isometrics where you're holding a position against a weight or you're holding that squat. And those can be really beneficial for knee function, even after a replacement.
Bob says he tore his ACL in his left knee, but still skis, hikes, bikes like a madman.
Good.
Any specific strengthening I should add to what you displayed?
Yes, good job, Bob. And so you are what we call a coper. There's some people born without ACLs that never had them. They live their life just fine. There's some people who tear their ACL and they're able to deal with that by maintaining the strength in their knee. And some of us aren't able to do that, and our knee feels unstable, and we end up getting an ACL reconstruction to improve the stability in the knee so we can stress it. And so it's fantastic you're able to do all those things. A very important function of the ACL is to protect the knee from sliding forward. So if this is the femur and this is your tibia, it keeps that tibia from sliding forward. It also protects against rotational forces. And so when you don't have that ACL, you have to rely on your muscles to do that stabilization. And so it's very important to maintain quad strength, but probably more important is actually your hamstring strength. Your hamstrings, most of them come from your hip, cross your knee and hold the tibia. And so what they're going to do is they're going to pull and prevent that tibia from sliding forward, similar to the ACL. And so hamstring strength in someone who's injured an ACL is really important. And it's actually shown that even if you do tear your ACL or get it reconstructed, the most important thing to prevent more injury or injuring the other side is actually hamstring strength. And so some of those exercises we talked about can be really good for that. Like the RDL, or the Romanian deadlift, is one really good way to work on your hamstring strength, as well as the way that you do your exercises and focusing on form, doing that posterior chain squeeze can be really, really helpful. Are there any other modifications you think for hamstrings that can increase that?
No, I think like what you said, driving through the heels to engage the muscles in the back with your squats and your deadlifts is important. And I think in this case, no two exercise strengthening programs are going to look the same. So there may be other exercises that we haven't discussed that would also benefit you.
How would a stair climber machine be incorporated into the strengthening routine?
So it could definitely be a good moderate warm-up if you're wanting to use it that way. Another way to use a stair climber that's incorporated into this type of exercise is focusing kind of on your lunges and on your squats. Essentially getting up a stair or doing the step-ups as well. It's essentially just doing those repetitively. So especially if you're having knee pain while you're doing those, it could be, again, your knees caving in. So kind of doing those step ups and seeing if, that knee's caving in, if you're doing those like clamshells and stuff to help with that glute strength. And then, also just making sure, kind of like they had talked about with the lunges, if you're having knee pain because your knee is going past your toe with the lunge, it may be the same thing with the step up, just trying to keep that knee in line with the ankle. And like Julia said multiple times, just pushing through that heel, to get more of that hamstring and that glute involved as well.
Yeah, and I would also say with the stair, with like a step up machine, you also have your arms. So you can play around with how much weight you're putting on your arms, and less weight on your arms, and the more that you're focusing on your legs, that will be more strengthening to your legs.
Yeah, and another way to sort of increase the workout that you can get is to do them slowly. And so it's really easy to just crank up the speed and just start going up, and that feels good because you go a really far distance or you've climbed a lot of flights of stairs on the thing. But actually slowing down, taking each step deliberately as though you're doing a single leg step up, can actually improve the muscle response that you get. And so those are great. They're also good for cardio. You're just going, you're getting your heart going, which is really good for you. But if you're focused on the muscle, the strength, doing them slowly with good balance, level hips, is really important. But that can be an excellent excellent tool. You don't have to have a stair machine. Just go find some stairs. They're everywhere. You just do them slowly, carefully, and keep your core engaged, keep those hips level, and focus on your form, like we've mentioned before. Form first, okay? That's the most important part of preventing injury and actually getting the true benefit out of the exercise. That's much more important than just speed or weight. If you go too heavy or too fast with bad form, you can injure yourself. And so start slow and then grow.
Someone is currently doing physical therapy. It's amazing how fast you can see results. How often do you recommend I exercise my knees a week after I'm done with physical therapy?
That's excellent. So Julia mentioned you should work every muscle group about every 2 to 3 days. And there's a scientific reason for that. If you don't use a muscle for 4 days, it will atrophy. That's how fast it happens. Okay. And so skipping leg day, if you're only doing leg day once a week and you skip one, I guarantee your leg muscles are atrophying. Okay. And so that's why it's important to continue our frequency. We don't always have to do the same level of intensity all the time, but in order to maintain and grow our muscles, frequency is important. And so doing that sort of 2 to 3, every 2 to 3 days, doing something to work the muscle is to prevent your muscle from shrinking. It's the use it or lose it. Your body is really efficient, and it keeps your energy being poured into the things you're using. And so if you're not using a muscle, your body will shrink that muscle and put that energy somewhere else. And so that's one of the reasons why we want to keep that that frequency up. Is really important for maintaining muscle mass, not losing it. This is also true when you injure yourself. If you hurt yourself and you go lay in bed for a week, your muscles are atrophying. You're going backwards. And so it's really important, even when you have an injury, to try and keep moving all the rest of your muscles. So if you hurt your toe, it's really important to be using your upper body, to be using your core, your back, your glutes, even if you're not putting full weight on that foot. You want to use as much of those muscle groups as frequently as possible, and sort of think about 4 days. If you hit 4 days, you're atrophying. And so when do you work out after PT? As soon as you can. But do it before 4 days.
Yeah, thank you, Dr. O'Connor. I think that was a great answer. And then I think just building upon what you said, if you are injured, you injure your toe on your left leg, it has been shown that if you're strengthening your opposite leg, there's still carryover in the strength that you're building on that injured leg. So even if you do have an injury, you should be strengthening that opposite leg to maintain the strength that you started with. in addition to that carryover effect.
Yeah, there's a couple reasons for that. One is that our brain is what talks to our muscles through our nerves. And part of the way we get stronger is actually by recruiting more of our muscle to fire. And that's essentially a signal that goes from our brain through our nerves to our muscles. And so doing that over and over strengthens those connections and can actually recruit more muscle fibers when you're doing exercise. So that's one of the reasons it helps, is that even though it's sort of the opposite side, it's still sort of using those things and you can strengthen those neural connections. The other is muscle itself produces a lot of what we call cytokines and chemicals that help your body heal. And so we know that patients who have more muscle mass will actually heal faster. And so you don't want to have an injury and let that injury stop you from working out so that you lose muscle, because then your body actually will probably heal slower. And so those are other good reasons that you want to keep exercising. You want to keep your muscle, even if you have an injury. You do have to be careful and sort of avoid injuring that thing, but the rest of you is fine. So you need to keep moving.
Time for a couple more questions.
Mm-hmm.
So when it comes to strengthening the muscles around the knee, does a rowing machine and an exercise bike help with that?
Yeah, I would say for an exercise bike, you can add you need to add resistance. You cannot, well, if you're on a low resistance, just going fast, you're not going to build strength. But if you are, pushing yourself with a lot of resistance, going slower, you can build strength. And then I also think it's important, another good way to kind of build strength and as well as aerobic fitness would be kind of doing intervals. So maybe a lot of resistance and then backing off on the resistance, but keeping a good cadence and maybe alternating a minute on and a minute off.
Absolutely. And so there's our muscles can get bigger and more efficient. And so sometimes if we're going for bigger muscles, sometimes we talk about doing heavier weight, more resistance. And what happens is we actually tear the little muscle fibers a little bit. That's why you kind of get that soreness in your muscle. But then as your body repairs that, it actually can increase how many essentially myofibrils or how big the muscle cells are. When you're going quickly for an extended period of time, you can improve the efficiency of a muscle. You can get better endurance. It's always good for your heart and lungs. That aerobic exercise is very important as well. But it's not, those particular exercises aren't necessarily designed to build muscle. You can modify them to do so. Like she said, go slow, high resistance, absolutely. Or do intervals, go quickly and hard for a while and then back off. Those are great when you have issues with your knee. So if you have some arthritis or some instability, a ligament injury or a meniscus tear, sometimes those can be very helpful because those are relatively controlled motions. There's not a lot of room for lateral motion or pivoting and twisting. And sometimes those sort of movements can be painful on an arthritic knee or a meniscus tear, whereas often going in line on the bike, having good form, or going in and out on the rowing machine can decrease a lot of those forces. So it can help you sort of keep moving the joint and sort of get some strength while sort of protecting you. So I would say those are good. They're not, they shouldn't be the end all be all. You do need to add strength, but those are great. And even we talk about joints, like the cartilage in your knee has no blood supply. It gets all its nutrition out of the fluid that's in your knee. And the way it gets it is by cyclical loading, okay? And so you have to move a joint for it to stay healthy, just even the cartilage itself. It's great for the muscle, it's very important, but it's very important for the cartilage. And so those exercises, if you're not able to work out with heavy weights or things like that, or let's say you hurt yourself and you can't go on your normal walks and hikes and things like that, that's a great way to keep your joints moving, keep the nutrients going in and out of the cartilage, as well as kind of maintain a little bit of muscle, but doing slow, focused, good form exercises under higher resistance will help with the muscle build as well.
And doing the rower and the bike in between those 2 to 3 days are a great way too, just to keep those muscles moving. Because I think a lot of us have experienced that we do a heavy lifting day and then our muscles are super sore. Instead of just staying on the couch or just relaxing and not really doing anything, getting up and moving is going to help get that lactic acid out of those muscles so they're not sore for as long, and you don't feel as stiff.
Yeah, and then going back to form, I think it can be overlooked on the bike, but also making sure that your knee is in line with the tip of your shoe or the second toe. You don't want that knee caving in, especially with that much repetition.
Absolutely. And then for some patients who can't bend their knee all the way, that's difficult, either with arthritis or a meniscus tear. Sometimes raising the seat on the bike will let you do that and make a rotation without having to bend your knee quite as deeply. I usually say if you just had an injury or a condition like that, start with the seat high, and as you're progressing and you feel like your range of motion is improving, your strength is improving, you can slowly lower that seat. Is a good way to get sort of that deeper range of motion. Just like we talked about in the squat, start with that quarter squat, and then go to half, and then full. It's similar. You can start with a high seat and then just gradually lower it to improve that range of motion and get more resistance into your knee.
We have time for just one more question.
Okay.
So, is a weight training regimen good for anticipation of a surgery or replacement for a successful outcome?
Absolutely. Super important. The stronger you enter that scenario, the stronger you will exit that scenario. And so if you're going to undergo surgery, strengthening pre-operatively is really important. It does a couple things. It maintains whatever motion you have, which is really important. It increases your muscle mass, which is actually going to help you to heal faster. Okay. And then when you have a surgery or some sort of event that does incapacitate you a little bit for a period of time, you're starting with more muscle mass. And then it's important to, as soon as you can, use those muscles. Remember, 4 days and it starts to atrophy. And so that's really important, both in the sort of pre-surgery and then as soon as you can to get moving. But I would say that is very important. We know that, like we talked about, exercise and strength training, it improves, like we talked about, muscle mass and healing. That's great. It improves your mood, anxiety, depression, and it's just generally good for you. And when you enter a surgery very depressed and anxious, recovery is hard. And so doing all the things you can to get your mind and your body right before you enter that is really important. And I think strength training is a very big part of that.
Yeah, I would agree, and makes me really happy when people are in physical therapy before they are planning to have a surgery, because it makes the recovery process on the other end a lot smoother.
Absolutely.
And you also kind of know what to anticipate as you're going through your post-op rehab.
Absolutely.
Yeah, you're not necessarily learning new things. You're just doing things that you're familiar with, which in the post-op period is a good thing. You can jump right into it. There's not as much of a learning curve. You just get to keep those muscles moving, stay strong, stay active. And that's what we want for you. We want you to be able to do the things that you want to do, that why we live in this beautiful place. And strength training, fitness is a huge part of that. And it does prevent injury. And if injuries do occur and you have to get a knee replacement or a hip replacement, it helps you recover faster and get back to doing all those things you want to do. And so super important. Thank you, Julia. Thank you, Shelby. Thanks everybody for stopping by. If you ever have any questions or need to either come see PT or myself with orthopedics, we'd be happy to see you. Thanks and have a great night.
Thanks for joining us.
We have a couple end of Q&A announcements. Our team would love to hear your feedback today on the presentation. If you have time to fill out a quick survey, it will appear right after the webinar is ended. You will receive an email with the recording of the webinar and the handout within the next 24 hours. The next Valley View University is Thursday, October 28th or 23rd at 12 p.m. with the Heart and Vascular Center's physician assistant Trevor Gerber. He will be presenting on aortic valve disorders. Thank you guys for joining.
Have a good night.